Matt Hand here, Dr. Matt Hand, the Chief Medical Officer for Square One Health. So CardioQMag contains a number of different things. It contains coenzyme Q10, potassium nitrate, magnesium. But the thing I'm going to talk most about today is something called S7. S7 is a proprietary blend of various polyphenols from plants. And when we look at nitric oxide production, we realize that these polyphenols play a really big component in terms of nitric oxide production. And in the past, it's been hard to prove the benefit. You got to make sure it gets there. You got to make sure it's metabolized. You got to make sure it makes changes in the body. Really hard to prove that. And nitric oxide, incredibly important in terms of looking at vascular tone and improvement of overall cardiovascular health. Also, these polyphenols and have have an antioxidant or oxygen radical scavenging type component that's very important. And so S7 actually was initially, some of the initial studies that were done back in around 2018 was a very small pilot study where they looked at oxygen radicals and whether or not they could decrease some of the oxygen radicals, looking at oxygen radical scavenging, and whether they could improve nitric oxide, particularly nitric oxide that's linked to hemoglobin, which is very important for oxygen delivery to the various cells and the endothelial cells and all the rest of the body. And that small study, which was just a handful of people, showed improvement. So in 2021, they did another study, and this was done out of the Journal of Food Research. And they said, let's take more people and do it in a placebo way. So they had between 40 and 45 people, and they broke them down into three groups. There's a placebo, there was a lower dose of about 25 milligrams of the S7, and then there was another one that had 50 milligrams of the S7. And they looked at time zero, which is when they started, and they looked at time 90 days to see, was there a change in any of the oxygen radical type components in the body, particularly looking at the mitochondrial component of these oxygen scavenging, radical scavenging, if you will. And then they also looked at nitric oxide, particularly nitric oxide related to the hemoglobin. They broke them into three groups. As I said, the placebo, the 25, the 50 milligrams, and they made sure that they didn't have any other comorbidities. So they excluded people that had diabetes or liver disease, or if they were on specific medications that might change this. When they compared the various components between placebo and the two other treatment groups, they found that they were essentially the same, but based on gender and body size. They actually wanted people that were overweight. So they didn't want to get ultra skinny people. They wanted people that were a little bit more on the higher side in terms of their BMIs, because they were actually looking at this from the standpoint of this is an important group of people that are dealing with metabolic syndrome. And what did they find? So they told them not to change their lifestyle, not to do anything different. And there was a once a day amount that was there. Now, the S7 is an interesting mix of a variety of different natural polyphenols coming from coffee, tea extract, coming from tart cherry, turmeric. Basically, they contain catechins, ECGC, cumin. There was a little bit of vitamin E, a little bit of vitamin C. Those were actually pretty low. There were some anthocyanins. So these were natural products coming from these plants that were in this component. And so they looked at what happened. And what did they find? Well, it was actually pretty striking. When they looked at the CMA, okay, which is specifically looking at metabolic effects with the mitochondria and looking at, and I'm not going to get into all the various different levels that they measured, but they showed a statistical significant change in the effects on oxygen radicals and oxygen scavenging. As a matter of fact, it not only changed, but when they compared it to the placebo group, the placebo got worse a little bit, and the rest of them got significantly better, and there was a dose dependency that also was seen. They also found the same thing when they were looking at at the nitric oxide, the hemoglobin nitric oxide. They showed a statistical significance in terms of the effect on nitric oxide production, and not only on nitric oxide production, but it was also some dose dependency, meaning they saw improvement related to that over between the 25 and the 50 milligram group. This is a really big deal because now we're now finding that we can impact nitric oxide production. We can impact some of the inflammatory aspects of oxygen radicals, and we can do this through plant-based products. And this is a nice blend, taking all of these components, putting them together, and working towards overall cardiovascular health. But I really wanted to start with a little bit of a deeper dive into the research studies that have been done related to the S7 as part of the CardioQMag. So, as I always say, if you simply look at the single leaf of the tree, you miss the beauty of the thousand leaves. And if we make the tree healthier, then the leaf becomes less of a problem. So part of Square One Health is to continue to work on improving health and improving health so the tree is healthy and the leaf has less of an impact on us. Okay, take care.